New at 5:30, could Medicaid be slashed under a new federal budget? U.S. House Republicans passed a budget blueprint last night that many say could lead to cuts for the program.
Yeah, although the budget proposal does not mention Medicaid specifically, some feel federal health care programs such as Medicaid will have to be looked at if billions of dollars are going to be slashed in government spending.
So Congress will still have to negotiate with the Senate version of the budget. But as our Matthew Torres explains, just the talk of these possible cuts is worrying many Virginians tonight.
We caught up with Michael T. as he left this food pantry in Arlington.
I don't know what I'm going to do.
The 49-year-old does not want his face shown, but he wants to talk about his concerns if Medicaid benefits are cut. Like tens of millions of other Americans, he relies on federal assistance for the health care.
About 6 to 8 months ago, I was diagnosed with prostate cancer.
For nearly 30 years, he was employed in hospitality with private insurance, but he lost his job more than a year and a half ago. Michael's worried about a newly passed House budget plan calling for $880 billion in cuts, which some say might impact programs like Medicaid.
Desperation, fear, hopelessness. I'm caught between finding employment or taking care of my health.
Roughly 630,000 people in Virginia benefit from the Medicaid expansion. In total, 1.9 million Virginians are enrolled in Medicaid.
Cuts to Medicaid funding have the potential for real serious consequences.
The federal government currently pays more than $5 billion a year to support the Medicaid system in Virginia. That's 90% of the cost. The rest is covered by private hospitals.
It would not be feasible financially to expect hospitals to pick up an even greater share.
Just before the Virginia General Assembly session wrapped up, state lawmakers approved a budget plan now heading to Governor Glenn Youngkin's desk. It failed to include a plan that explicitly addresses possible funding cuts to the state's Medicaid expansion. Right now, if federal contributions go below its usual 90% coverage, Virginia has a trigger law to withdraw from Medicaid expansion.
But it also has an impact on the ability of that provider to continue to provide services to all patients.
I think we need more humility than partisan politics. People need to put themselves in other people's shoes and ask, what would I do if I was in this situation?
Matthew Torres.
Thank you. You have a blessed day, all right?
WUSA 9.
This afternoon, the Virginia House Democrats released a statement saying this isn't fiscal responsibility, it's cruel and a direct attack on Virginians, especially those in our rural communities who rely on Medicaid for life-saving care and SNAP benefits to put food on the table. Meanwhile, President Trump has sent some mixed messages on any cuts to Medicaid, but he said he would not make cuts to Medicare.